And I was told you would be able to join us just until 4 p.m. Is that right? Do you have a...
Yes, that's correct.
All right. So if, with that in mind, then I think I'm going to open things up for questions for you. So we have a mic in the room, and I'll just ask people to identify themselves so you have a sense of who's asking you these questions.
Jack Spengler, Harvard. Nick, thank you so much for that thoughtful comments that you provided. So I think you're absolutely right. I like the process that you're thinking about as food is the gateway drug to healthiness, and as we know it is for obesity and other things. And so it struck me recently when I found out that the WIC program, maybe $8 billion in this annually for this country, specifies what can be reimbursable, but the SAP program with $80 billion doesn't. You can buy anything. So could you elaborate more on your sort of public influence in the marketplace that might drive populations to better choices that might be available to them?
Yes, I think that's the rethinking how those billions of dollars that SNAP spends, much of which now goes into unhealthy food and subsidizes, Pepsi and Coke and other unhealthy food makers, is a really important opportunity. And I only have the most basic thoughts. We're doing a little bit of work here in East Harlem of looking at stores that already accept SNAP, and there are a lot that do, and that offer healthy, affordable food. We're calling those places food oases, within the food swamp of unhealthy food or the food desert of no healthy food. And we're looking to develop community-driven marketing campaigns to encourage people, particularly people in public housing where there are high rates of diet-related disease, to patronize these food oases as a way of growing these businesses and increasing the demand for what they provide and that other SNAP vendors might not provide. That is one thought. I also think the model of health bucks, where you provide incentives to SNAP recipients to use it for healthy food, that $5 of SNAP would be worth $10 if you buy it only for healthy food. I'm reluctant to limit SNAP to healthy food because that restricts things for poor people in a way it isn't restricted for others. And there've been a lot of debate within that, and it really divides people. So I'm looking for finding incentives for people for SNAP to use it for healthier food. So I hope that speaks to your question.
Yes, Jack, back again. I'm going to offer a suggestion. I was so impressed. I was touring Malmo, Sweden, which is a sustainable city in many features. But through their public housing, on the sides of their building, there must have been 2-story high pictures of people in the community. They're very ethnically diverse in this community, with the food of their native cultures that they served. And they created a cookbook and then created restaurants right within the complexes that they lived. And so they celebrated their ethnic diversity through their common culture of food. It was really well done, and it might be an idea that you can think about.
That's great. In some places, in cities in Brazil, they also have subsidized restaurants that offer healthy food at a steep discount, and also use it as a economic development project for local farmers, because that's a guaranteed market. So these quasi-public restaurants buy from local producers and then sell at a discount.
John Balbus with NIEHS. Thanks for that talk. I was very struck by some resonance with something that we discussed earlier on in the day. I had asked a question about transformational change and what was going on within the field of health that was actually moving towards not just change, but sustainable transformation. And one of the answers was the hiring of community health workers from within the neighborhoods as one way of institutionalizing this knowledge and embedding it within the communities. And I'm so very, very struck with your comment about community health workers as again, a way to create community-level transformation and to include such things as certification for food, and I could see other kinds of, certification in disaster preparedness as we talk about community resilience, et cetera. What I don't have a whole handle on is the Affordable Care Act or anything else providing enough of a market incentive to pay and train and have community health workers in these communities so that it is a sustainable field? And where do you see this going? Is this, you could load so much on it, and yet I'm just not sure about its viability. Could you just comment a little bit more on that?
Sure. I think that a lot of people are talking about this within the healthcare sector, and there are provisions of the Affordable Care Act that provide, and of Medicare that provide reimbursement for patient navigators, at a decent salary. Those are folks mostly to enroll people in healthcare, but there's also been, there's a lot of action at the state level around certifying community health workers and making them eligible for different kinds of reimbursement from insurance companies. So I think with the development of health homes, and to think about those health homes having a community focus, a community-centered health home, which is a concept developed by the Prevention Institute, as well as, taking care of the people who walk through the door. I think there's a possibility that community health workers could take on some new roles, not only in chronic disease management, which I think has been worked out to some extent for diabetes and heart disease and blood pressure, but also for chronic disease prevention. And that would be a huge potential cost saver. And I think we just need, there's more evidence that needs to be accumulated to document the potential benefits of that, and then to translate that into demonstration projects and then policy.
I mean, if I may, I do think that is an area where CMS is doing some experiments, and PCORI as well. And so there are a lot of funded projects around the country that are looking at those questions, but that there is going to be some variability given the fact that some states aren't actually establishing exchanges, nor are they expanding state Medicaid, so therefore they would not have the need to hire people in some of these roles. Perhaps the federal government might hire them, but it's a very different kind of thing. Dick?
Yes, and I think what's sort of possible in this era is demonstration projects that raise the question of going to scale, not nationally, but, within a region. And if we can, over the next 5-8 years, gather evidence that could show that it is possible to go to scale, it can save costs, that could, in a slightly longer time period, contribute to, better policy.
Here in Washington, there are people at George Washington University who have a large Center for Medicare and Medicaid Innovation project, over $20 million actually, to try to do that, creating a kind of community-based health homes for people with HIV/AIDS. But it remains to be seen if these things work. But it's pretty exciting that they're at least trying to innovate. Dick?
Nicholas, great to hear your voice. Dick Jackson, congratulations on your terrific book, Legal But Lethal. Quick comments. One, Walmart and McDonald's are actually losing money at this point, in part because people that would be their customers are still getting minimum wage, and the failure to pay people living wages is making the people...
and the SNAP cuts.
Right, exactly. On the UCLA campus, we've got about 85,000 people, and there was a big push to put a lot more student housing on campus because of costs in the nearby region. It turns out it's been a very good investment in terms of sustainability, and the miles and carbon footprint's gone down dramatically as more of the students are living on campus. We've put bike share in place. But one of the things that had to happen, and believe it or not, Shea Panisse and Alice Waters has been important in this, is a massive upgrade in the quality of the food, a lot of locally grown and relatively simple but good quality food. And it's made the numbers of young people going off campus to get food, and for that matter, alcohol and other things, go down quite dramatically. And so it's interesting how the environment issue, the health issue, the social issues come together. And then third, the SNAP issue. I always struck the arguments I get into when I say we should not be using our tax dollars to buy junk food, and people say I'm imposing my values on someone else, Nick. So we just have to see where we go with that one.
Thank you. Nice to hear your voice, too.
Thank you for that, Dick. Okay, we're going to move now to our last speaker, Hazel Edwards, whose first name, I believe, has one A in it, right? So your card.
Thank you all very much. Bye.
Thank you very much, and we really appreciate your having been able to join us today.
Great. Look forward to reading more about your work today.